Hey, Dr. Tyler Williams here, and thanks for taking a minute to watch this video. You're here because you have some questions about dental implant or dental implants versus a bridge, and it's a common question, one that we're asked quite often, and one that many people come to the office for or search us up for because they don't know which is best for them. And in order to fully answer this question, you need to understand a little more about what a dental implant is and what some of the bridge options are. And we have some other videos you can check out on our channel for more on that. But for the purpose of this video, we'll just talk, generally speaking, what a dental implant is. So an implant is a replacement for your natural teeth or missing teeth, and there are different types of implants. So when you're talking about an implant versus a bridge, it's also important to know there's multiple types of bridges. So there are removable bridges, which would be like a denture. They don't hook anything. They suction to your gums, or they, if you have maybe a few teeth, a bridge would clip in and clip out. That's usually not the kind of bridges most people are looking for these days. So with a bridge, you can have maybe say you're missing one or two teeth, or one back tooth breaks, and you can grind down a tooth on this side and grind down a tooth on this side. And then in the space in between, there'll be a fake tooth connected to that bridge, and it's a ceramic piece, and it spans that space just like a bridge would. If you think about the Golden Gate Bridge, there's a pier on each side that holds the bridge, and then over the middle it's just kind of floating. So when you have a bridge, say I was missing one back tooth and got a bridge with 3 teeth on it, the middle tooth would be connected to the ceramic and just floating there. Now, typically in our office, because we adhere to a biomimetic protocol, we don't very often do bridges anymore. The number one reason is typically you'll need root canals on those teeth, or they'll have to be ground down very, very small in order to fit that bridge. And you have to lose all of your enamel in a lot of cases where, in fact, probably most cases, you don't have to lose that much enamel. So it's too aggressive. We think about it as something similar to saying that if you had lost your big toe and you wanted to get an artificial toe, if I came to you and said, well, I have to take your whole leg from the shin down in order to fit that toe on, it's probably not the best option. And 40, 50, 60 years ago, it was the best option. But now that we're all living longer and taking better care of ourselves and chewing longer, enjoying more foods, more quality of life, it's typically better to have independent teeth. So in that same scenario, instead of having 2 teeth ground down that were perfectly healthy teeth in order to fit that bridge, I would just leave those teeth untouched and put an implant in the middle, single tooth, and now you're in good shape. So in that case, generally an implant's going to be better than a bridge. Cost-wise, they're probably pretty similar. Some cases the implant may be a little more, but some cases the bridge is actually more. So the most expensive doesn't have to be the best, but the other type of bridge is a removable bridge, and this is a bridge that clips in and clips out. So it could be like a flipper or a little fake tooth that you snap in there and you take it out at night. Those are okay transitionally, but if you have them that way for a long time, they can damage your teeth, damage your gums, cause your bone to recede. So probably not the healthiest option. Now, the other type of bridge is going to be an implant bridge, and there are clip-in implant bridges that snap in or clip in, and then there are screwed-in implant bridges. So if you've ever seen Teeth in a Day, heard of those options, those can work out well, but this means that all of your teeth are taken out, you have a whole bunch of bone cut away, and then you have a bridge connected to 4 or 5 implants screwed into your jaw, and you leave with those teeth. The upside to it is teeth don't move. The downside is they are more work to clean and more maintenance. And we've had people come and see us because they didn't like this type of bridge. They wanted something they could clean easier, and so they switched to something else. However, most people are happy with this, but a lot of people I see are actually not good candidates for us because they could save their teeth. So just be careful who you work with, because if you go to somebody who only has hammers and you ask them if you should use a hammer, of course, they're going to tell you you should use a hammer. So that's kind of the one-size-fits-all approach, which we don't believe in. We believe that your treatment should be customized just to you. And then even the treatment that you have compared to your sister or spouse or friend is going to be different. The snap-in bridge can be really great too. This is an implant bridge that clips in and then it clips out. If you think about like a Western shirt button that you kind of push in and it clips in and clips out, the same type of thing. So these aren't dentures, okay? These are a bridge with teeth on them that you would snap in, snap out. They're easier to clean than the screw-in type. They chew about 50 to 80% as well as the screw-in type, but they're going to chew 3 to 6 times better than your regular denture, which most people hate. So the point of this is avoid the denture whenever possible. Avoid grinding natural teeth or healthy teeth down whenever possible. Save your teeth within reason. And then when it comes to getting implants, you need to decide, do you do a single implant, a snap-in bridge, or a screw-in bridge? And most importantly, have a trusted team to work with that's going to be there for you, not just now, but down the road. Nothing is forever. And so you want to be working with someone who understands the maintenance and the process to keep your bridge and your mouth healthy. So if you have some more questions or comments, please leave them below, or you can reach out to our office. Our information's in the bottom of this video. And thanks for watching. We will catch you on the next one. Have a wonderful day.